Welcome to Mind Matters, where we dive deep into the questions that shape our mental health and well being. In today's video, we're exploring the top 10 questions people commonly ask therapists. These are the questions many of us have silently wondered about, but haven't always known how to ask or where to find answers. If you've ever found yourself feeling anxious, stressed, or lost in your thoughts, stay tuned because we're tackling these concerns head on with practical tips to help you lead a healthier, more fulfilling life. Question number one: why do I feel anxious all the time? Anxiety is something many of us experience on a daily basis. It's the brain's natural response to perceived threats. But when you're feeling anxious all the time, it could be due to a variety of factors. Chronic anxiety can be triggered by stress, unresolved trauma, or even biological factors like genetics. Therapists help clients uncover the root causes of their anxiety, whether it's tied to past experiences or current stressors, and teach techniques like cognitive behavioral therapy, CBT, mindfulness, and breathing exercises to manage it. Quick tip: start by identifying your triggers. Keeping a journal of moments when anxiety spikes can give you insight into patterns and help you regain control. Question number two: how can I stop overthinking everything? Overthinking can feel like a mental trap where thoughts circle endlessly and prevent you from taking action. This often stems from fear of uncertainty or perfectionism. The brain tries to anticipate every possible outcome, but this leads to mental exhaustion. Therapists suggest grounding techniques like thought stopping, where you actively interrupt negative spirals and setting time limits for worrying. Over time, learning to sit with uncertainty and not needing every answer will quiet the racing mind. Quick tip: practice mindfulness to bring yourself back to the present moment. Focusing on what's happening right now helps break the cycle of overthinking. Question number three: how can I improve my relationships? Relationships are complex, and conflict is inevitable, but many clients struggle with communication. Whether in romantic relationships, family dynamics, or friendships, people often feel misunderstood or disconnected. Therapists work with clients to improve communication skills, focusing on techniques like active listening, assertiveness, and learning to express needs without blame. Improving relationships often starts with self-awareness. Understanding your emotions and triggers allows you to respond instead of react. Quick tip: focus on listening more than speaking during conflicts. Sometimes just being heard is enough to diffuse tension. Question number four: why am I so unhappy even though my life seems fine? This question touches on what's often referred to as high-functioning depression or emotional numbness. People can feel unhappy despite having stable jobs, good relationships, and a seemingly perfect life. This disconnect happens when we ignore our emotional needs in favor of external success. Therapists encourage clients to explore what truly brings them joy and helps them feel connected. Often there's a lack of fulfillment or purpose behind the surface. Quick tip: reflect on your values and whether your daily life aligns with them. Living a life true to your core values can help bridge the gap between success and happiness. Question number five: how do I deal with stress better? We all experience stress, but chronic stress can take a huge toll on both mental and physical health. Whether it's work, family, or personal responsibilities, stress comes from feeling overwhelmed by demands. Therapists offer coping strategies like setting clear boundaries, practicing self-care, and using stress reduction techniques like deep breathing and progressive muscle relaxation. Quick tip: break tasks into smaller, manageable pieces. Feeling productive, even in small ways, can reduce the feeling of being overwhelmed. Question number six: why do I keep repeating the same mistakes? It's frustrating to find yourself stuck in the same patterns, whether it's in relationships, jobs, or habits. Often this happens because of unconscious beliefs or fear of change. You might be stuck in a comfort zone, even if it's not healthy. Therapists help clients explore these underlying beliefs and provide tools to break free from negative cycles. Understanding why you're repeating the behavior is the first step to change. Quick tip: reflect on your past choices and see if there's a pattern. Awareness is the key to breaking free. Question number seven: how do I let go of the past? Letting go of past trauma, bad relationships, or regret is a common struggle. Emotional wounds can linger, keeping us from moving forward. Therapists help clients process these experiences through techniques like talk therapy, EMDR, eye movement desensitization and reprocessing, or trauma informed approaches. The goal is to integrate the past into your present without letting it control you. Quick tip: practice self compassion. Healing doesn't mean forgetting, but learning to live without letting the past define you. Question number 8: am I normal for feeling this way? Everyone has moments of doubt, wondering if what they're feeling is normal. Whether it's sadness, anger, or anxiety, clients often seek validation that their emotions aren't strange. Therapists reassure clients that emotions are a natural part of the human experience. Feelings are signals, not flaws, and understanding them is key to self growth. Quick tip: remind yourself that it's okay to not be okay. There's no normal when it comes to emotions, everyone experiences them differently. Question number 9: what can I do to boost my self esteem? Low self esteem can hold you back from reaching your potential. Therapists often work with clients to help them identify negative self talk, build confidence, and shift their mindset towards self acceptance. Small wins, affirmations, and focusing on strengths can gradually improve self esteem. Quick tip: start a journal of your accomplishments, no matter how small. Reminding yourself of your successes can help build confidence over time. Question number 10: how do I find meaning and purpose in my life? Many clients struggle with the existential question of meaning, especially when they feel stuck or unfulfilled. Purpose doesn't have to be grand. It can come from everyday connections, creativity, or simply following what feels authentic. Therapists help clients explore their values, passions, and how to incorporate more of what brings them joy and fulfillment into their lives. Quick tip: reflect on moments in your life when you felt most alive. These experiences can offer clues to what brings you meaning. These are the top 10 questions that people commonly ask their therapists. If you relate to any of these concerns, know that you're not alone, and there's help available. Therapy offers insight, support, and practical tools to live a more balanced, fulfilling life. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more mental health content from Mind Matters.